Chris with Rowe Dental Laboratory. If you're doing a photogrammetry or grammetry workflow and you're printing your temps in office, or maybe the lab's printing their temps, but you seem to be getting more breakages than you want. Of course, you want zero breakages, but things happen. But if you're getting an increased amount of breakages, I think we have a solution for you that will help out with those temps, whether they're short-term temps. Some patients wear them longer term as well. So we have a great solution for this. But prior to that, I want to make sure of a couple things you're looking out for with your temps. Typically, the same day temps, the immediate load temps, you want to make sure that there's no cantilever, so no extensions off that terminal implant. Also, another big thing to look out for, of course, is your vertical space. Is the prosthesis thick enough? We want to make sure there's enough vertical. Maybe you can open the patient a little bit more if you don't have enough thickness on that prosthesis. And then there's always the bite. You want to make sure that bite is dialed in perfectly. Now, to a lot of you, this may seem obvious, but I just want to make sure I run through a couple things that we see with temps that could propose an issue. Again, check the bite, make sure there's no cantilever, and of course your vertical, make sure that you have enough bone reduction done. Kind of hard to do after surgery, but that's one thing to look out for. Now, if you're still getting breakages, it's typically due to a passivity issue. Now, we have an awesome new product called our Passivity Plus coping. So typically we put our Passivity Plus copings in final zirconias. Again, it's a self-adjusting coping, so as you screw down your final zirconia, it's going to seat in the most passive position across the arch. But if you are seeing a lot of breakages in your temps, then this is also a great solution for your temps. The way the Passivity Plus coping works is on your end, the digital workflow, you do nothing different. And then you can seat that Passivity Plus into the prosthesis. You just cement it in, and because it self-adjusts, it'll seat that temp in the most passive position also. This is also a great solution for those patients where you know they're going to be in their temps longer term, past that 4 to 6 month time frame. Maybe they're saving money for that final. Well, the Passivity Plus coping can help with eliminating the passivity problems or potential passivity problems and keeping them in their temps without breakages, or having them call you on a weekend, something broke, and you got to come in and hit print on your printer and waste some more chair time taking care of the patient. So just something to think about in your temps if you're seeing some breakages, or if you want to avoid breakages, especially on the long-term temps. Our Passivity Plus coping is a great solution for you. If you have any questions about Passivity Plus, whether it's in the temps or the finals, please give us a call here at Rowe. You can also check out our Passivity Plus page on our website, and we cannot wait to start doing Passivity Plus cases with you. Thank you.